Right, let's come to the big discussion of today where we're talking about COVID-19 and what's happening there. Are we coming to a stage of an endemic where the pandemic now is petering out? We will still have little flare-ups of infection, but not to that level. Or is the Delta Plus variant going to be troublesome? What about the third wave? There's a lot of conflicting information coming in right now. Even as we were preparing for the show comes the news that in the state of Kerala, there's been a 30% hike in COVID cases in the last 24 hours, fueled by Onam festival celebrations. So over 30% jump in just 24 hours. Death rates have jumped as well. To get a clearer idea of what's going on, I'm joined today by Dr. Shahid Jameel and Dr. Chandrakant Lahariya. We're going to be speaking to Dr. N.K Arora, Chair COVID Subcommittee NTAGI, in a bit as well. So welcome to all of you. Dr. Jameel, let me begin by just getting your take on what we're seeing in Kerala. Now, the COVID cases in the state of Kerala have been a bone of contention for some time now. There are some who say that the numbers are high simply because there's better testing and tracing. But these, constant peaks in numbers, do you find that worrying, especially when test positivity rate are in the high double digits?
Well, of course, it's worrying, but I think we must also recognize that Kerala has controlled the disease very well. So we may be seeing more infection, but the disease and the deaths have been controlled really well. And what Kerala is paying for is really how best it controlled the pandemic in the first phase and in the first wave and the second wave. And that is sort of certified by the ICMR Zero survey, which showed that Kerala had the lowest zero prevalence of all states. So yes, I think we should be concerned, but this constant worry is doing nobody any good.
Absolutely. Dr. Lahariya, how do you look at the situation in Kerala? I want to focus on what's happening in Kerala first and then talk about the other aspects of the COVID-19 situation in the country. But Kerala specifically, does it point to possibly the start of a third wave, or do you think it's a problem contained within Kerala itself?
I would not say that there is a problem in the Kerala. Of course, it's a matter of concern that it is reporting large number of cases. But if we objectively look at the purpose, the objective of pandemic preparedness and response interventions, the purpose is to reduce the number of transmission or number of cases, to reduce the transmission of virus. And Kerala has successfully done that. We know through Zero survey that the zero positivity across the country has been lowest in the Kerala because of the effective containment measures which state could implement for a long time. Then second purpose of pandemic response is that anybody who get infected has a good outcome, and that outcome is measured in terms of mortality or case fatality rate. The case fatality rate in Kerala has been successively really low, lowest in the country. So on both the parameters, the delaying the infections or transmission of virus and also case fatality, Kerala is doing really well. Of course, since there is a susceptible population, then we need to do all the measures to ensure that transmission is halted. And for that, we need a micro-containment strategy. And of course, a vaccination is one of the strategies which should be done. But that's something which has come now. So in my opinion, of course, Kerala is doing well. In pandemic response, what we need to know that we need to detect as many cases as possible. And that parameter, Kerala is detecting as many cases. But we also need to remember that out of every 6 case infections, Kerala is detecting 1 infection. But through ICMR Zero survey, we know that nationwide, out of every 30 infection, only 1 infection was detected across the country. So definitely we need to pay attention, but it's not matter of worry. On the parameters, objective parameters, Kerala is doing really well.
So it's not so much about whether the state of Kerala is performing well or not, or, are they doing a good job or a bad job? I know this debate has gotten skewed and muddled with the performance of every state government. The question is emerging from understanding where the COVID-19 infection rests at this point in India. So Dr. Lahariya, let me come back to you with that aspect. The reason we're focusing on Kerala this evening is because we're wondering whether we are going to see a third wave. could the numbers in Kerala be fueled by some kind of new strain? Or are we now plateauing enough on infections and have enough vaccination rates to feel like we're nearing the end of this pandemic?
So what we need to remember that there are two factors which are very much in our control. One is the vaccination rate and also COVID appropriate behavior. And if people keep following those, I think we can sustain this high baseline of currently being reported cases. And especially majority of the currently being reported cases are coming from two states. So if these two states can effectively contain, India can achieve a really low number of daily cases, and that can be sustained if we can increase vaccination coverage. But there are two other unknowns, so which is if any new variant emerge, and we know that a new variant which is highly transmissible or immune escape, other characteristic, that can be detected in over a period of 3 to 4 months and not before that. So unknown variant or new variant is something unknown which we cannot predict. But if assuming that there is no new variant, India can be fairly safe position. But the final part of my answer is that at the nation as a whole, because overall numbers are dependent upon what other states are doing. As an example, if Kerala number goes down and Maharashtra number goes down, but some other states start reporting higher number of cases, then aggregate or average will come around the same number, but that could be a next wave for that particular state. So while it's important that we look at the national numbers, but we should be paying attention on state-specific numbers and also on the districts. So while nationally we might not see a bigger peak, like it might go to 40 to 60,000, but in some states which are currently reporting a few hundred or a few thousand cases, it's very likely in some pockets the number of cases can go to from 1,000 to 10,000, and that would be a subsequent wave for that state. So final, in my opinion, there is a limited value of what is happening at the national level. We should be paying attention sub-national and district level now, and those settings can still have subsequent wave.
I also have Dr. N.K Arora with us on the show this evening. Dr. Arora, great to have you on the show. I want your comments first on, the peg that we've started the discussion with, which is the high number of cases reported in Kerala in the last 24 hours. I'll preface with the same thing I said to the previous speakers. I know this has become an issue where people are pointing fingers at this state government and that state government. My simple question is that should we be concerned that this could be the beginning of a fresh wave?
Oh, in fact, Professor Shahid Jameel is also there, and he, in fact, was associated right from the beginning with INSACOG, Genomic Surveillance Network. And as late as early August, whatever samples have been picked up from Kerala and other states where the number of cases are high and the test positivity rate is more than 10%. All the cases which are coming are almost all are Delta variants. So first of all, which Chandrakant was also saying, that any new wave is likely to be driven by a new variant, because otherwise in most part of the country, 70 to 80% of the population is already infected. Kerala, fortunately, had managed it so well that almost half of their population was uninfected, but now they are getting infected. The second thing is that I think whenever there are laxity, or as we say, savdhani hati durghatna ghati. So in two religious functions, I think there have been, these have both been followed. We had Onam a couple of days ago, and then we see a spike today. Previously, Eid was there and there was a spike. And the central team which had gone there, they found that contact tracing was hardly being done, or it was inadequate. So without pointing fingers, what basically we are saying is that the attention to details for containment and always keeping the threat that the susceptible population can always get infected if there is any kind of giveaway on the corona appropriate administrative as well as personal behaviors, then it becomes difficult. But the important point is that across the country, I am sure you people media must be looking at weekly INSACOG bulletin. Almost 100% of the genome sequences are Delta. And from Kerala, a large number of samples have been picked up, which do not show anything of concern. These days, the system has been built in that the system should be able to pick up a new variant or a suspicious variant in 3 to 4 weeks time. So from 3 to 4 months, this efficiency has been tried to improve so that in 3 to 4 weeks, the variant is picked up. So the good news is that at the moment, we don't see any suspicious variant across the country. So what we are seeing here is the susceptible population in various pockets of the country, including Kerala and Northeast, and some district-wise issues across some of the other southern states and eastern, the Odisha and Andhra Pradesh. And we hope that as more susceptible people get involved in the transmission, the wave should come down. The second thing is, I think one of the very important reason and appreciation for Kerala is, I just saw while we were discussing, Chandrakant and Shahid were discussing, 2 crore plus vaccines have been given, out of which 78 crore doses are 2 doses. Second doses have been given. So, which is much higher proportion as compared to rest of the country. So vaccination program seems to be going very well. That also influences the severity of disease and risk of fatality. Because if the vaccine is given, even a single dose, but if 2 doses are given, then obviously protection from severe disease becomes much better and risk of death. Beyond that, the care-seeking behavior in Kerala is very distinct from rest of the country. In fact, for pediatric age group, we have seen the care-seeking is almost 6 times better as compared to the rest of the country. So I'm sure for adult also it must be similar, and so people seek care much early, and we know that risk of death and other adverse outcomes are much less. So overall, what we look here is that intense transmission is going on because there is a larger pool of susceptible population there, one. And I think we need to be extremely careful and avoid any kind of gatherings, social, religious, political. All these gatherings are the major risk factors, and that's what we have been seeing in last 4 or 5 years.
So, do those risk factors now subside with the increase in pace of vaccination? Let me take that question to Dr. Jameel. We talked about how the spike in Kerala may have been caused by Onam, before that with Eid, and we are on the cusp of another round of festivals coming in India, in different parts of the country. And it will start probably from second week of September or so. So is there a pattern there which can serve as a warning sign to us?
Well, the pattern is already there. If we don't see it, it's our fault. We've repeatedly seen it. I mean, just like Narendra was saying, we've seen it in Kerala with Eid and Onam. And before that, we saw it with the state elections and with the Kumbh Mela. So all the data is there. We can continue to be blind about it, and that's our choice. So the pattern is there. And, I will reiterate what Narendra said. We have to be very, very cautious in the days ahead. Today the flavor of the day in media is that we are closer to endemicity. I don't think that's true at all. We haven't heard the last from this virus. So we can't really say that. And, please don't give out the message through your channels that we are getting close to a virus becoming endemic. I know what Soumya said. Soumya didn't say that. But somehow, her remarks have been picked up only partially to highlight what everyone really wants to hear. Nobody wants to hear the inconvenient things. But the point is that all the data is there for us to see, to act, and to take precautions. And we must continue to do that.
That's a very important clarification coming in from you, Dr. Jameel. So, you are saying in no uncertain terms that we must not think we are close to endemicity. Where then would you mark us on this pandemic journey? We've finished 2 waves. We are preparing for a third. Vaccination is progressing. It should be going faster, but it is ramping up for sure, slow and steady. So how would you then describe where we are on this journey?
I wish I could tell you that I would be very popular or very rich or whatever. But unfortunately, I don't think any one of us have that answer, because how the virus will mutate, we don't really understand this. What are the selection pressures of the virus? We don't understand that. So I wouldn't venture into this and say that whether the pandemic will end by mid 22 or end 22 or 23. I just don't know. Uh, you know, the virus is of course going towards endemicity. It's like saying that every year on your birthday you are getting closer to death. Of course you are. But when you will die, you don't know that. So it's the same case here. Yes, the virus is going towards endemicity. It will become endemic. When it will happen, none of us can predict that. At least I'm not brave enough to predict that.
Dr. Arora, you want to come in on this point of endemicity? The thought behind it is that infections have been stable now for some time. The third wave, if it comes, might not be that bad. Also because a large number of people already got infected in the second wave and will have that protection as well.
So what I would say, I totally endorse what Shahid is saying, that endemicity occurs for those organisms where we know their behavior. Tomorrow, if interesting variant comes up any part of the world, and obviously it will not take much time to reach India also, then there is another wave. So the only redeeming point will be that those who are immunized will get mild disease, or they will not die, or they will not be requiring hospitalization. But this endemicity, I think it will take another year or so to understand the virus. Has it reached the saturation point? Shahid is a virologist, he can answer it better. But at the moment, really, we cannot say that the virus has reached that stage where something will not happen or something will happen. So this issue, concept of endemicity, I think we keep it at the back of the mind. But I think the answer is, at the moment, immediately third wave is unlikely because the way things are moving. But we should be prepared for the worst. We should prepare our health system so that we can handle any eventuality. We should prepare so that vaccination takes place at the rate which is committed to the country. The third thing is that we do meticulous genomic sequence across the country so that if and when, even if there is a remotest suspicion, that is picked up and appropriate action, public health action.
Dr. Arora, since I have you here, I want to ask you about vaccination of children as well. ZyCoV-D has got the EUA and is being tested for children above the age of 12. Would you suggest that now we start large-scale vaccination of children, and you're also, I believe, in favor of sending kids back to school?
So I think time has come that children should go back to school, starting from primary school, because they are at least risk. But coming to the vaccination of children below 18 years, we have 44 crore population. Second, children have very mild or mostly asymptomatic disease. Severe disease is rare, and deaths are even rarer than that. So at this time, the adult immunization is very important. We just saw the data that people over 18 years, 18 to 45, are at 15 times higher risk of death and severe disease as compared to children. So we must immunize first children. However, now since the vaccine is available, ZyCoV-D, we will be working so that there is a list of comorbidities, and these children can then be given a vaccine on priority. But healthy children, vaccination will only start and should start after the adult immunization is completed. I will.
So by when do you think vaccination? Just one last question, sir. By when do you think vaccination will start for children above the age of 12? Now that ZyCoV-D is out there, but by when will the process actually begin?
The process we have 4 or 5 weeks before we come up with the morbidity list. And I think the rollout of the vaccine is in the first or second week of October. Prior to that, we will have a public list of priority children who can get the vaccine, 12 to 17 years old.
Okay.
Thank you very
Dr.
much.
Lahariya, if I can get your view about vaccinating children and going back to school.
So, this is a global evidence that children need not to be vaccinated before they can attend school. Essentially, the evidence is that children do not have any additional risk if they attend school, and they are already at a lower risk. Going to school does not alter the risk which they have at home. So that's why school should be open. The second part is that there is evidence that rate of moderate to severe illness and mortality follow a J-shaped curve in all age, which essentially means if you look at the English alphabet J, then bottom of the J would be 10-year-old. And the risk is the lowest for a 10-year-old child. And then it increases in the both direction. 9-year-old has a slightly higher risk, 8-year-old has slightly higher risk. And then similarly for 11-year, 12-year, up to age of whatever 85, it goes high. So the J-shaped curve essentially means 10-year-old child has the lowest risk, and 6 to 13-year has the lowest risk in the children. And that's why primary school should be open. And I'm saying that this 6 to 13 has the lowest risk, but all the children younger than 18 has a lower risk, as we heard from Dr. Arora, who said that 18 to 44 years, which is also healthy adult population, has 15-fold higher risk. So children are really safe. Coming to the vaccination, no country in the world is doing vaccination for younger than 12 years. But schools are still open on those countries, and that itself is a proof that vaccination is not a requirement. Even for 12 to 17 years, only few countries are doing vaccination. And I want to give an example of United Kingdom. United Kingdom has sufficient supply of vaccines and licensed vaccine. But when their researchers and scientists looked at the data, and they concluded that all children in 12 to 17 years do not need COVID-19 vaccines. So UK is vaccinating only high-risk children, something on the line which Dr. Arora is also suggesting. So I want to reiterate 3 things. 1, children can go to school safely. Anything over and above, like vaccination, is add-on, but that is not a prerequisite. Second thing is that the primary school should be open first, then upper primary, then older senior level school. And third thing is that whenever schools are open, parents need to be assured that they would continue to have choice whether they want to continue the study of their child as an online mode or a blended offline online mode. So much of the discussion on not opening school is based upon misinformation and apprehensions, which can be addressed by the open and transparent dialogue. And final point, like this is high time, like state like Delhi, which have 25 new cases every day, there is no reason that the school should not be open. And I have heard that today expert committee submitted recommendation, but I don't understand why it should take so much of time to by DDMA to deliberate, or for any state to deliberate. This is a decision which should be done really quickly, and school should be open.
Absolutely. Send them back to school, say the top medical experts. Very important comments coming in here for those who have been been tracking this debate. Thank you so much to all of you for joining us. We'll take a very short break. On the other side, we have an exciting discussion for you as well. We're talking about the national monetization pipeline and why this government plan has become such a huge political flashpoint. Mamata Banerjee is the latest opposition leader to say that, these assets belong to the nation, not to the BJP. They can't be sold. Nirmala Sitharaman, the finance minister, has hit back today saying that nothing is being sold and the opposition must first understand what the plan is. What is really going on? That debate coming up after this break.